We're back, everybody. Welcome back to another episode of the 7 Figures or Bust podcast, the number one podcast in the world for growing your insurance business. This is episode 150. Big milestone episode for us here today. I'm Christian Brindle, and I am joined with no one today. It's a solo episode. Glenn Shelton is still out of town. And you're stuck with me, ladies and gentlemen, for the next 40 to 45 minutes or so. Hope this episode finds you doing well on a Friday. We got a lot of important topics to cover today. We have news that broke recently of a Medicare Advantage carrier, a regional one at that made the tough decision to drop all of their Medicare Advantage members and cut a pretty substantial amount of their workforce in connection to that for 2026. This is not the only situation we've seen like this coming into this AEP, and this is actually a multi-year thing that we've actually seen, and we're going to kind of jump into this a little bit and have a conversation about it. Before we get too deep into that, though, I want to make sure that I talk about the ESI AEP kickoff for you guys, okay? If you're not already aware, next Monday, September 8th, we are holding a massive free virtual event for Medicare agents that we're calling the ESI Everything Senior Insurance AEP Virtual Kickoff. It will be from 10 a.m. to 6 p.m. Eastern Standard Time. Okay, so this is an entire day long event. And I will be presenting, Glenn will be presenting, and we have multiple representatives from various carrier partners of ours coming to represent and coming to present what their benefits are going to look like from a broad national scale and what their plans are focusing on for 2026. Carriers like United Healthcare, carriers like Humana, Aetna, Devoted Health, HealthSpring, formerly known as Cigna, Molina, Physicians Mutual. So this is a stacked event, and it will be an all-day thing. People have been asking me, will it be recorded? I don't know. It very well might be a situation where either you register and attend live or you miss it altogether. This is as good as it gets when it comes to AEP virtual kickoffs. If you are watching live on the live stream of this morning, you can find the link to register in the comment section, okay? Like I said, this thing is free. It's free. Anybody can attend. We have almost 2,000 people that have RSVP'd already. We expect that number to be a heck of a lot higher over the weekend from now until Monday. And we're going to be doing a lot of prep this weekend for it. So we're very excited and excited to see you all with your smiling faces on Monday. So just wanted to make sure everybody was aware of the AEP kickoff event. Okay. All right. Let's kind of jump into this topic at hand. So news broke recently that a regional carrier that goes by the name of UCare in Minnesota made the decision and publicly announced this decision and put it in their request to CMS, which most certainly will be accepted, to terminate their Medicare Advantage plans entirely, meaning every single plan they have and every single member that has a Medicare Advantage plan from them will have their coverage terminated at the end of the 2025 calendar year. I'm going to share my screen for those of you that are watching on the video version of this, whether it be live or on replay, and we'll go into the actual article and talk about the details of this, and then I'm going to share my opinion in terms of why this is happening, because this isn't the first type of news like this that we've seen. We've seen a lot of disruption, not just on plans pulling out, plans canceling, but also news on carriers making decisions that they don't want you to sell their plans anymore. They're making certain plans non-commissionable, more suppressed plans, all of that stuff. So we're going to jump into all of that on this episode today. Okay, so this is a Yahoo News article written by Mars King with Pioneer Press. Okay, this was written Thursday, September 4th, 2025. So literally yesterday from the time I'm broadcasting for you. Okay. The article starts off by saying, UCare is looking to suspend its Medicare Advantage offerings, the insurer announced Thursday. UCare, a Minneapolis-based health insurance nonprofit, made a request to the Centers for Medicare and Medicaid Services to mutually terminate its Medicare Advantage product offerings for 2026, according to a news release from the insurer. Quote, this decision was not made lightly, said Hillary Marden Resnick, UCare president and CEO. In the release, UCare remains deeply committed to the health of Minnesotans and to supporting members through upcoming transitions. Apparently, they're still going to be offering other types of health plans, but no Medicare Advantage. Now, how many people are affected by this? The article continues by saying UCare currently has 158,000 Medicare Advantage members and is the second largest Medicare Advantage carrier in the market, with 26% market share, according to the release. So this carrier in Minnesota is a big deal, has a quarter of the market share for Medicare Advantage. 158,000 members is not a small amount. It's nothing to sneeze at. So agents that sell in Minnesota or live in Minnesota most likely are selling this carrier. It might be one of their top carriers for a lot of you. You're going to have to rewrite all those people. All those people are going to be without coverage for 2026. Okay. The article continues by saying the nonprofit cites the cost of healthcare and increasing challenges of the overall market in its decision. To maintain financial stability and continue providing quality, affordable coverage, UCare is aiming to focus its resources on programs where it can have the most impact. End quote. Pending approval of the request, impacted members would need to select a new coverage option during the upcoming annual election enrollment period. Medical assistance, Medicaid, Minnesota Care, special needs plans, individual and family plans, and Medicare supplement will still be offered by UCare. Another interesting part of this, the change will also affect 9% of UCare's workforce per the release. Okay. So that means that 9% of this insurance company's staff are going to be without employment. Most likely, staff members that worked directly on the Medicare Advantage side of the business. Thursday's announcement comes just 2 months after the insurer announced its plans to withdraw from the non-senior Medicaid coverage in Ramsey County and 11 others, affecting 88,000 members. Founded in 1984 by physicians from the University of Minnesota, today UCare serves more than 600,000 members throughout Minnesota and parts of western Wisconsin. Okay. So, this is a bombshell for Minnesota insurance agents, but if you're not in Minnesota, why should you care? What does this have to do with you? Well, I'm going to tell you. I'm going to explain that part to you, okay? Without getting into names, because carriers don't usually like it when you name them, especially on platforms like this that reach thousands of agents on a day-to-day basis. There's a lot of plan cancellations going on in 2026. It's not as dramatic as an entire carrier pulling out entirely, but you have national, huge carriers involved that are pulling some of their plans in many areas. Last year during AEP, we saw an estimated 2 million Medicare Advantage members see their plans terminated. That was a record high in the history of Medicare Advantage at that point in time. This AEP is looking like it's going to top it. You have carriers that are huge national carriers that I will not name. They'll remain nameless, but they're on the Fortune 500 list. They're massively publicly traded companies. Have put out information that they're terminating 600,000 members, one carrier. And of course, the big ones, the big fish, the ones that we all are aware of, they're all having certain plan terminations across the country, some more than others. But it totals up in well over 1 million people, if not 1.5 million people, between those 3 to 5 big fish carriers. So you're seeing a lot of plans terminate. I've also seen people celebrating about PDPs being available at $0, or if not $0 in your market, maybe affordable prices in your market, maybe $8 to $10 in your market. I've seen it be a couple different ways, right? And it looks like there are going to be 2 carriers that will pay commissions on PDPs for next year, just like this year. Okay. But what people aren't being honest about when it comes to the PDP conversation, there's 2 aspects of it. 2. The first one is, while some plan options remain low, the vast majority of them have gone up. You can't dispute this. I saw one PDP option in our own market. The estimation of it shows that it's going to be under $10 a month in 2025, going up to over $100 a month in 2026. 1 year, guys. Now, the second part of this, why are we seeing that? And why are some carriers still offering low-cost PDP plans? It's because, if you remember, before last AEP, there was a government subsidy that came in at the last second, in the final hour before AEP, to offer subsidized help for PDP companies that agreed to reduce their price increases to a certain amount, and they could opt in or opt out of the program. Well, vast majority of companies chose to opt into the program. But they made the decision this year to take that away by a third. So it's a third less of a subsidy this AEP than it was last AEP. Next year, the plan is for it to be reduced by another third. And slowly but surely, this subsidy will start to go away. So what PDPs look like now is not the finished product of all of this. Not by a long shot. And just because there's some affordable options doesn't mean the average cost of the PDP in general is much higher in 2026 than it was in 2025. I don't think anyone that's genuine and honest with you will dispute that, right? And it's a problem that's going to continue to get worse. So you have plans canceling, lots of plan disruption. A majority of carriers, when I've been looking at the first looks, I'm sure you have as well, they're getting reductions in their benefits. I can't really think of too many plans that I've seen so far. Granted, I haven't looked at every plan in every market, in every city, in every state. But the first looks that I've looked at so far, I can't think of too many plans where I can look at that plan and say, wow, overall, top to bottom, that plan is better next year than it was this year. Not a lot of those, right? So plan benefits reducing on the Medicare Advantage side, a continuation of what we saw last year. Now, we're starting to see more and more carriers as well, a lot of regional carriers also putting out notices that certain plans of theirs are going to be non-commissionable, suppressed, everything like that going into this year. So it's going to be a little bit more of the same in terms of that. And the question becomes, why is this happening? Why are we seeing this type of disruption? Starting in AEP 2024, I guess it's AEP 2025, but last year, 2024, coming into this year, 2025, extending into 2026. Why are we seeing this? Well, it's simple, my friends. Couple of different elements of the economy that when this first happened, I was one of the few people that shouted from the rooftops that we were going to see this exact type of impact. And that's the Inflation Reduction Act. Let's kind of review. What is the Inflation Reduction Act? For those of you that don't know, Inflation Reduction Act was passed in 2022, and it had a whole litany of things affecting the economy, but several elements of it that affected prescription drugs in America and Medicare prescription drug coverage. It's what spawned our $2,000 mandatory max out-of-pocket cap limit that carriers must abide by that took effect January 1st, 2025. Next year, it'll be $2,100, right? I've talked about this on the show before. The previous system, as imperfect as it was, had been around from 2005, 2006. Some of you listening probably were in the business at that point in time, so you can probably give me the exact date or exact year. But let's just say 05, 06. Somewhere in there is when Part D was passed by the Bush administration and it became a thing. The old system with the donut hole, with the 4 stages of coverage, right? Deductible stage, initial coverage stage, donut hole, also known as the coverage gap, catastrophic coverage. That system was intact with a few changes here or there. Nothing dramatically changed in the structure of it, though, for 20 years. So they had 20 years to adjust, especially on the Medicare Advantage side, on how a plan from an actuarial perspective could balance their benefits. Because remember, with a Medicare Advantage plan, it's all in one. It's everything built into one. It's medical benefits, it's prescription drug coverage, it's ancillary benefits. It's the extra goodies, right? So how does a carrier balance from an actuarial perspective what they can offer and remain profitable and what they can't offer? They kind of got that down to a science for a while. All of a sudden, Inflation Reduction Act passes, and there's several elements of it that took effect as time went on over the years. I'm not going to get into every little detail of it, but the main aspect of it that affected these types of impacts within our industry on plans was, without a doubt, the $2,000 cap. That, again, started January 2025. 2024, they did have a max out-of-pocket limit when you got into catastrophic coverage. That was the first time that ever happened, but it certainly wasn't $2,000. It was a much higher amount than that, but that was really technically the first year there was a max out-of-pocket. The smart carriers started early. 2 AEPs ago now, they started to slowly regress their benefits because they knew that over a short period of time, probably a couple of years from then, the entire industry is going to be flipped on its head. What a carrier could profitably afford to market and provide in their plan coverages would not be the case post this $2,000 cap taking effect. And so when you have this, you have a systematic change in how prescription drug coverage works in the Medicare space. Now, is it a bad thing? Well, let's kind of analyze that a little bit. And I've talked about this in nauseating detail, but I wanted to really walk through it on today's show. If you analyze the old prescription drug model and you analyze the new prescription drug model, the new prescription drug model helps those individuals that are taking a lion's share of medications. We've all seen them. Somebody taking 20 medications a month, 25 medications a month, maybe 30 medications a month. I've seen it all. Okay. There's people that were paying $5,000 to $10,000 a year in the best plan possible on their prescription drug plan on the old model. And it sucked for those people. Now, there's certain things that they can explore, right? Patient assistance programs, ordering certain medications from Canadian pharmacies, right? There's like certain things they could explore to try to get those costs and those expenses down. But when you look at the actual totality of the coverage, they were still left behind $5,000 to $10,000 of out of pocket from what their insurance left behind. Those people saved a lot of money with this $2,000 cap taking effect January 1st, 2025. Now, how many people are there that are in that boat versus people that were in a boat where they were spending less than $2,000 a year? The vast majority of people either pay the same on their prescription drug costs right now under the new system, or they pay slightly more. Maybe they save a little bit, but it's not much. They're in the same ballpark. And that is the truth. When you look at the data, the vast majority of seniors didn't save money on their prescription drugs with the $2,000 cap. The people that are taking the lion's share of the medications have, but those people make up 10% or less. So that means 90% probably didn't save much, if anything, on their prescription drugs. But the domino effect is everybody is seeing their plans deteriorate in some way, some form or fashion, get worse in some particular way, or the vast majority of plans. Far more people are having negative impact on their overall plans than the people that are being helped on the prescription drug costs. And this is what I predicted when the first news broke of the Inflation Reduction Act being signed. When I really looked into what was actually being passed on it, I'm like, oh, I'm no economist, probably should be. I'm no politician, probably should be. I'd make a lousy politician. I'm totally being facetious when I say that, but it was obvious for anybody that had insight of our industry that this will increase drug costs exponentially for carriers, that money's got to come from somewhere. It's got to come from somewhere else in the plan. Translation? From other benefits that the plan is offering. This episode of the Seven Figures or Bust podcast is brought to you by Everything Senior Insurance. Guys, if you're looking for an FMO in 2025 to be a partner with you and really support the overall growth of your business, Everything Senior Insurance is the one-stop shop to allow you to get plugged in with great resources. Whether it's ACA contracts you're looking for, whether it's Medicare contracts you're looking for, whether it's final expense and life contracts that you're looking for, Everything Senior Insurance has got you covered. We provide a free CRM in seven-figure CRM to all of our agents that meet the proper requirements on their contracting and have enough contracts with us. We provide discounted leads with Lead Heroes, discounted virtual assistants with Hire Heroes, and we provide just year-round support to just be there and help you out in your business, as well as fantastic training. Glenn, what do people need to know about Everything Senior Insurance, the FMO?
At Everything Senior Insurance, we've really combined all of our resources to create an FMO that can be a true one-stop shop for a senior insurance agent. Most FMOs have only maybe one resource or even no resources beyond offering that contract. We want to provide value to you as an agent to help you grow your book of business. Or if you want to create an agency, we want to help you grow your agency. And there's so many resources that we have put together to really help you grow your business. So if you are looking for a true partnership, someone that will invest in your business, please reach out to Everything Senior Insurance. We would love to help.
Now, Inflation Reduction Act, right? Again, it was proclaimed by the media as a good thing, as something that was actually helping Medicare beneficiaries. But when you actually see the full picture, it's clear that it's not. Now, Is it going to go back to the way it was before? No, I don't think it's ever going back. I think this is the new system of what we have. And I've talked to people in our industry that are extremely knowledgeable, high up on the totem pole, a lot of which have been around longer than me and seen more shifts in the market than I have. I got started in this business in 2014. But every person I respect that I've had this conversation with has kind of all said the same thing. This is going to be a multi-year shift. It's not about last AEP, just like it's not all about this AEP. You're going to see disruption and shifts and carriers trying to figure this out for several years following. You might see after this AEP 2 more like it before things start to stabilize and be what they're going to be in terms of what's reasonable and what's actually realistic for carriers to offer in terms of coverage. This also has domino effects in terms of carriers having non-commissionable plans. Now, I've talked about this on the show before as well, but carriers have always had non-commissionable plans. As long as I've been doing this. Last AEP, there was a list from a major carrier of non-commissionable plans that was circulating and being presented as if a year prior, and people were freaking out. And my message was, hey, attention, you have not been able to sell these plans all year round, and you didn't even know it. And you're doing just fine, and you did just fine. Are there more non-commissionable plans because of this? You betcha. Sure. There's also plans being consolidated. The new model for carriers is they need to balance out their plans, their Medicare Advantage plans, benefit-wise, to be able to sustain the drug coverage that they have to commit to. Right? They have to balance it out. They have to make sure that the max out-of-pockets work, the hospital copays work, the doctor copays work, the dental, vision, hearing benefits work, the over-the-counter item benefits work. It all has to mathematically make sense, and you really aren't ever going to completely know that until you have a couple years at least of data that actuarials can take a look at. Now, are actuarials perfect? Do they make mistakes? You bet your ass they do. They're pencil pushers. But they need some time of this new system to be able to figure things out. It's so crazy to me that everybody thought that come January 1st, 2025, it would be figured out. No, the carriers are kind of learning on the fly just like everybody else. That's why last AEP, you saw carriers in the middle of AEP making plans non-commissionable and suppressing plans. We've never seen that before. At least that I haven't. In the middle of AEP, the timing of it was extremely suspicious. But what it really ended up coming down to is carriers were getting more enrollments into certain plans than they thought they would. And when their actuaries crunched the numbers based on how many members were going on the plan and where they were projecting the enrollments to end at, they were like, oh, we're in trouble. 2025, we're in trouble. We have to find a way to slow down these enrollments on this plan. And that's what carriers did. A lot of those plans that were made non-commissionable last year and this year, earlier this year, are terming next year. Not all, but a lot of them. It's because the carrier didn't want the business, and the carrier, simply put, could not sustain the level of coverage that that plan was providing. So when you really look at it from that type of perspective, it all starts with the domino effects of the Inflation Reduction Act. It changes everything from a structural point of view on how Medicare Advantage plans are able to operate. And some carriers, like UCare, clearly are now looking at it from a perspective of, we can't make money the way we want to in Medicare Advantage. So we're out. Anytime you see massive systematic changes in how a product is supposed to work, you see a lot of people run for the hills and a lot of disruption. Carriers in particular, run for the hills. If you look at when ACA passed, when ACA became a thing, there was a while there where there was a lot of carriers that that did not want anything to do with that space. Because you look at the system before that, right? There was underwriting, there was health questions. The carriers could control who was able to come in and get coverage. All of a sudden, they have to accept everybody. And again, it takes multiple years of actuarial data to figure out how to make this work and the program to kind of get legs underneath it and build itself out. That's what's happening right now with Medicare Advantage. It does not mean that Medicare Advantage, it doesn't mean that Medicare Advantage is a product line that's going down the tubes. It doesn't mean that Medicare Advantage doesn't have a strong future or it's going down, like a lot of people want you to believe. It's just a systematic shift. And you can look back at history of any type of systematic shift on products like Medicare Advantage and see that things get shaky for a little while and things move backwards, take a step backwards for a little while. And that's where we're at. That's where we're at right now. Unfortunately, who is in power can make decisions like this that can pass bills that can turn your whole world on its head, right? I don't mean to get political about this, but you look at the Biden administration. The Biden administration passed the IRA, responsible for all these shifts and disruption we're seeing. Now, maybe you think it's a good thing, to which point, great. I'm not saying I think it's a bad thing. I'm not saying I think it's a good thing. It's just explaining the cause and effect of what we're seeing. Oops, sorry about that, guys. Little technical difficulty there. But when it comes down to Medicare Advantage plans, it's an argument, I guess, that could be made. You could make the argument that they are more well-balanced now because there is a max out of pocket on prescription drugs. And there was a potential possibility that someone could be out of pocket significant amounts of money. And so everybody's going to have their opinion, but the Inflation Reduction Act, Biden administration also put in Chiquita Brooks LaShore, our previous CMS administrator before Dr. Oz came in. Now, is Dr. Oz good? I feel like it's a little too soon to say. Well, let's have this conversation in about a year from now, and we'll see kind of the impact of on agents of his legislations and final rules and everything like that. But I don't think anybody that understands even a slight amount of our industry would say that Chiquita Brooks LaShore was good for our space. What did she bring? Crushing regulation that made no sense. Total pencil pusher regulation under her leadership. A clear agenda to make agents' lives harder. Maybe well-intentioned in some ways, mostly trying to regulate the call centers, but it ended up affecting the independent agents like you and me more than anything else. Not saying it didn't affect the call centers, but man, oh man, from basically 2022 on, maybe 2021, I'd have to go back and look at the actual years of it, but we had a yearly final rule. And the final rules, you think about the first one, right? The first one brought the phone call recording rule. That shook everybody up a little bit because a lot of agents were just working off of their cell phone, driving to people's houses, working out of their garage, their basement. They weren't recording every phone call. Now, you could make the argument that they should have been. Even if it's not a rule to record your phone calls, you should. But it's a totally different animal when you are required to record your phone calls and store them for 10 years. That was a thing. The next year final rule, 48-hour scope of appointment comes back. A rule that I'm on the record saying helps no one. Not a soul. Not one person. And I won't get into it again on today's show, but it's just a ridiculous rule. Then, 2024, they put out the final rule that tried to kneecap FMOs, get rid of overrides, get rid of marketing money, get rid of all administrative payments, which was fought in court by several organizations. Shout out Senior Security Benefits, shout out Integrity Marketing, shout out AmeriLife, all of which proceeded in lawsuits. And it ended up with that, the crux of that final rule never really seeing the light of day, but it was potentially crippling. Then they put out a proposal where they wanted to change the definition of communication and marketing. For those of you that don't know, if you post something on Facebook saying, hey, I'm Little Billy, I'm your local Medicare specialist, and I can help you, give me a call. You're not mentioning any specific plans. You're not mentioning any specific benefits. Communication, by definition, you do not need to get it approved by CMS. You do not need to get a CMS SMID code. You don't need to have it reviewed by a carrier. Why should you? It's stupid. It's just, hey, this is my business. This is what I do. Give me a call. But marketing is when you actually talk about specific carriers by name, specific benefits. You have to get that approved by CMS in order to run an ad, send out a mailer, anything of the above. And you have to get a CMS SMID code. Well, they wanted to combine those two to where any mention of your business that had to do with Medicare Advantage or PDP had to get CMS approval. SMID codes. Radical, crazy, stupid. Let's say you make a YouTube video. You can't publish it until it gets reviewed by CMS first. That makes sense. That's radical. So I say all this to say the jury's still out on Dr. Oz, but what I can say on Dr. Oz is I don't feel like he's pushing regulation, at least yet, that's trying to crush us. So when you look at the Inflation Reduction Act and you look at the CMS leadership under the Biden administration, man, were we punched in the face hard as agents with the after effects of all of that. Now we'll see how things go. I'm not saying necessarily I'm super bullish on Oz or anything like that. I don't know. We'll see. But we're now in September of 2025. It'll be interesting to see what Dr. Oz does in the next 12 months in terms of legislation, in terms of rules that are passed, in terms of really cracking down on agents, or if he loosens rules and loosens the screws up a little bit. So you want to know why this stuff is happening in the Medicare Advantage world? Non-commissionable plans, suppressed plans, canceled plans, market shifts. And if you're somebody that's out there and you're a one-man show, and let's say you have 1,000 clients, and you're going to have to rewrite half of them this AEP, and you're like, man, this sucks. This is so much work. This is crushing. Why is this happening to me? It's the Inflation Reduction Act, my friends. And a lot of people have been saying it. It's become a bit of a buzzword, but I've been saying it for years. When it first dropped, I talked about it in the Facebook group. I talked about it in YouTube videos. I definitely was early on this trend. And so now the market needs to stabilize. Like I mentioned earlier, all the smart people I know in this business that I've had off the record conversations with without naming any names have kind of all had the same opinion that we're going to have multiple disruptive AEPs where the ground feels a little shaky underneath your feet, allowing the market to stabilize to be what it's going to be going forward. It will never be what it was before. It won't. Very unlikely, unless something else systematically changes that shakes things up once again. But in the distant future, it won't be what it was before. In terms of the same Medicare Advantage benefits, they're not coming back. Not anytime soon anyway. And we will see disruptions through and through after this year. Some of you are having the attitude that I just need to get through this AEP. Don't think so. I think it's this AEP, it's probably next AEP, and potentially even the AEP after that you have to get through. But understand, right? These things have consequences, and politicians that pass bills about things they don't understand have lasting effects. Because remember, the Inflation Reduction Act wasn't passed by CMS. CMS was involved in terms of giving feedback, but CMS doesn't understand the Medicare agent distribution world. They've admitted it. They've said on the record multiple times they don't understand FMOs or what they do or what they're for, or what their business model is. So they don't necessarily understand the industry they're regulating. But when you have a bill that's legislation that's passed, it's not a rule from CMS, it's legislation. That's even scarier because they have even a lesser understanding of the domino effects and the after effects that affect not necessarily you or me. Yeah, certainly we're affected, but affecting the seniors, the Medicare beneficiaries. And that, to me, is where the biggest problem lies. Anyway, guys, I appreciate you guys watching all the way to the end on today's show. I wanted to just kind of go into some final thoughts on episode 150. Next week, I'm expecting Glenn to be back. So if you miss him, he will be back. If you don't miss him, I'm sorry, he'll be back. But no, I'm excited to have him back on the show. I think our banter is always good, and it helps us get more content into the show instead of me just ranting. But maybe you like me ranting. I don't know. There'll be more opportunities for that in the future. My final thoughts, you guys, are, again, we've seen this before, this type of disruption before. I mentioned ACA earlier. ACA is a good example, right? There weren't carriers that wanted to touch it for a long time. The market had to stabilize. And that's what we're going through right now. The market needs to stabilize. So it's so difficult for most people to see more than just what's in front of their face, than what's going on at that specific point in time. But look at this from a 3 to 5 year lens. And when things get rocky in the Medicare space, I've been around 11 years now. Some of you have been around a lot longer than that. But I've seen multiple shifts where it's a bit of a roller coaster. It's lucrative, it's not lucrative. It's lucrative, it's not lucrative. It's lucrative, it's not lucrative. And the people that weather the storm and stay through it are the ones that build massively successful businesses. And so I'm bullish on the future of our industry. I had somebody the other day tell me that I'm doom and gloom. Anybody that thinks I'm doom and gloom in terms of my messaging to agents. My messages to agents is understand what's going on, acknowledge the problem, adjust, but we're going to be just fine if you do that. That's my message. So weather the storm, and don't be surprised if we see multiple AEPs that are relatively chaotic and disruptive before things start to stabilize. I appreciate you guys watching all the way to the end on episode 150 of the 7 Figures or Bust podcast. I hope you found it helpful, enlightening, and brought you some good information and some context that might be helpful just surrounding of what's everything that's going on. Make sure to, if you're watching live or on the replay, it doesn't really matter. Make sure to like, comment, subscribe, give a 5-star review, whatever the platform of your choice that you like to digest the show allows you to do. We certainly appreciate the support. And we'll be back next week with new episodes of the 7 Figures or Bust podcast. Thanks, everybody. Here's to your massive success, and have a fantastic rest of your Friday and weekend. We'll see you on the next one, everybody. See you later.